Hi guys, Dr. Allison here with Dr. Maria. She's going to help me demonstrate some breathing exercise today specific to any kind of shoulder pain or stiffness or mid-back pain and stiffness. If you have difficulty with bench pressing, overhead pressing, this might be a breathing technique that you would like to try. Now, if you remember from my introductory to breathing video, I talked about how the ribs attach to the thoracic spine in the back. And sometimes these joints can get super stiff. If we're used to breathing into our chest and our belly a lot, these joints don't know how to move properly. If these joints aren't mobile, then your shoulder blade won't move optimally, and therefore your shoulder won't move optimally. So we're going to talk about moving these joints, breathing into our back in order to optimize shoulder health. So the first breathing technique we're going to work on is that posterior expansion into the back of the rib cage. What Maria is going to do here is she's going to get into a slight posterior pelvic tilt. She's going to tuck her tailbone underneath, and her hamstrings are going to feel super active. Her feet are elevated on a bench, 90 degrees of knee and hip flexion. I'm going to add a ball between her knees to get her adductors fired up so her core is a little bit more active. I use a weighted ball to make it a little bit more challenging, but you could do just a regular like Pilates or yoga ball. She's going to put her hands straight up towards the ceiling, and she's going to do a Serratus Punch. So she's going to reach to the ceiling from her shoulder blade and armpit area. She's going to try to avoid any compensation from the upper trap, keeping her shoulders away from her ears. In this position, she's going to take a deep breath in towards her back. She's going to try to expand into the back of her rib cage, and she's going to exhale through an open mouth. She's going to do that 5 times. She's really focusing on trying to keep this rib cage nice and depressed and not flaring it up towards the ceiling. And again, really expanding into that back, into the floor. So now we're going to do the deep breathing that we just did, but with a dumbbell chest press on one side. Maria's going to get in the same position. She's going to get that tuck of the tailbone, active hamstrings, squeeze of the ball. She's going to have that serratus punch towards the ceiling, shoulders away from ear, and rib cage nice and depressed. She's going to take a deep breath in, trying to expand in the back of the rib cage, and then exhale as she presses up towards the ceiling. Now what she's going to try to do is avoid on the way down her shoulder on this side or the hip on this side coming up off the floor. She has to keep this oblique super active by, again, really connecting to that rib cage and keeping it down and depressed. So if you want to progress this and make it a little bit harder, you can take a kettlebell and put it in a bottoms up position to get more shoulder stability. We still have this serratus punch here reaching up towards the ceiling, still have this rib cage nice and depressed, and still working on our breathing and coordinating a chest press with the bottoms up kettlebell. So she's going to take a deep breath in and then exhale, press up.